Thanks for joining us, Phil. I want to thank everybody for tuning into our destination series. Once again, we have done 13 destination series. We've been all over the world. We've talked in detail about most all of the trips we offer here at Worldwide Trekking. You know, it's been a different kind of year for us, of course, and we are all excited. I know that the vaccine is out and that's being distributed. But there's a lot of little things that go along with that. And I want to introduce Dr. Levy. He's a good friend of mine. I'm going to call him Phil as we go through this because we've been friends a long time. And I met Phil up at Snowbird years ago. He's an avid skier, comes out pretty much every year. And he had been generous in giving patrol talks to our ski patrol. And we did some skiing and spent some time together. And then in 2007, I started Worldwide Trekking. And Phil agreed to be our medical advisor. A number of times throughout our last 14 years, guests sign on for trips and they might need to take a medication like Malarone to go to Tanzania or Diamox, or maybe they're taking something or have some concerns about their health and travel or what they're going to try to do. And Phil's been really generous with his time in consulting those people with emails or phone calls. So Phil, I want to thank you for that. That's been just awesome over the years.
It's been my pleasure, Dean, and thanks for the kind words.
And, you know, as well, Phil is on our HOP board. He's a board member with the Human Outreach Project. And, you know, aside from that, those are just small little tidbits of Phil's professional career. Phil is a medical doctor. He has a master's in public health. And boy, Phil, I could go through your whole bio here. It is extensive and impressive, to say the least. As I read through it a couple times, I gotta say, I was like, wow, this is all Phil's stuff. He's heavily involved in a number of different associations. And if you're tuning in today, you probably have read through the newsletter and saw his bio on there. I would say that one of the things that's really interesting is you know, at the end of his bio, you know, he's internationally recognized as an expert in cardiovascular disease research. And, you know, he is a principal investigator for the cardiovascular related grant projects funded by multiple entities, including the Emergency Medicine Foundation, the Robert Wood Johnson Foundation. And, you know, over the last 10 years, Dr. Levy has published more than 160 manuscripts and authored 21 textbook chapters. And he lectures all around the world and all across the country on cardiovascular related disease. And I know that's just a smittens of your bio, Phil, but can you tell us what you've been doing the last year? I know you've been on the front lines and heavily involved here.
Yeah, and thanks. Sorry to put you through reading that. I sit here and cringe every time I hear people read the bio, even though I write it and it feels good to put the words down. So in the last year, we've actually, as the whole world has been, have been COVID focused. Very early on, so I'm an emergency physician. I still practice in Detroit Receiving Hospital, and early on, in March of last year, Detroit and Michigan were getting hit pretty hard, and our hospitals were getting overrun. And what was actually happening in addition to that was first responders, police officers, firefighters, medics, doctors, left and right were getting exposed to COVID and having to quarantine. And so the police force in Detroit at one point, 50% of them were out on quarantine. You know, the Detroit police are already overworked. Imagine a 50% reduction in that. And so what we ended up doing, there was a gap in the availability of testing. So initially we set up testing for first responders and healthcare workers at a couple of different sites, one in Dearborn, one in Detroit, tested about 3,000 healthcare workers in 3 weeks, and then pivoted very quickly to start to do community-based testing and partnered with the Ford Motor Company to develop an approach and outreach using mobile health units that we upfit and designed with the Ford Motor Company, and have been going out into the community in various locations. We've done more than 500 events since April 13th when we launched this program at 220 different community partner sites, and have vaccinated or tested close to 45,000 people since we put all of this together. So it's been quite a journey, and along the way, I have learned a tremendous amount about COVID risk in communities, population needs, and sort of some of the broader changes that are probably on the horizon after healthcare. After COVID, I think healthcare is never going to be the same again.
Phil, I think thank you for all of your assistance. I'm sure it's been a really busy year for you, so thanks for taking the time here today and all that you've done for Worldwide Trekking and HOP over the years. I know you're an avid traveler. We climbed Kilimanjaro together. We've been heli skiing together and skied a number of runs over the years. And that's what we, as you know, with Worldwide Trekking and HOP, are excited to hopefully get back out there in the world. So today, for the guests that have joined us, please chime in with your questions as we go here. I'll look through them and then we'll ask them as they're appropriate, and I can get them in. But I want to keep it a little bit more open forum. Normally I show a PowerPoint on the destination. Today we're going to have more of a conversation, so your questions will be welcomed as we go through this. So Phil, I'm getting ready to go to Nepal next Friday, and I am going to we're not running a trip for our guests. I'm going over to trek into Faraday to break ground on a new medical clinic building at the aid post there, and with the Himalayan Rescue Association. I've had my vaccine since January because I am a first responder with the patrol at Snowbird. And I was thinking if we went through some of the stuff with that to begin with, and we'll see what kind of questions and topics that you feel free. So pretty open forum today.
Yeah.
We do have trips. My trip to Nepal, we've got a group getting ready to go to Peru the end of May, very first of June, really. Then I'll be going to Tanzania to do a climb on Kilimanjaro. We're uncertain about the Alps and what will happen there as we move forward. We are pivoting with those trips if need be to offer a trip of the same time frame and cost to Iceland, where you can travel with a vaccine. Alps trips, hopefully by the fall, we'll be going. And then in the early winter and through next winter, we'll have Patagonia and Aconcagua coming up. So we're going to be moving all around. We also have trips here in Utah, and I think domestic travel is even also a concern for us as we go. So Phil, I'm going to get tested and jump in at any point here, but my plan is to get tested this Tuesday, Wednesday, because I fly on Friday. So is there a certain type of test? I know there's like tests at the airport. There's a lot of different clinics and different tests that are available. What do you think about the testing, and what do I need to be thinking of when I go get my test?
So, I think this is relevant for everyone who's tuning in, now, or you're going to watch this subsequently. There's a lot of rapid change occurring in this landscape. The most important thing that you said is that you're vaccinated, because that really changes some of the things that are required of you. And a lot of the requirements are not necessarily requirements from this country when you travel out of country. They're requirements for the country you're entering, who may or may not want to see a COVID test before you come in. So I thought I would, if it's okay, kind of run through just a couple of slides that I pulled off of the CDC website that I think will help provide some clarity around this. So give me a second to pull this up here. And hopefully you can see my desktop right there. I can. Yeah, it's Salvador, Brazil, by the way, Dean, if you ever want to go to a beautiful beach. Brazil, Salvador, Brazil. But I wouldn't go near Brazil right now on any type of travel. They seem to have quite the battle going on, and I think you can see when a country doesn't or tries to politicize COVID and sort of takes the ball and runs with one direction, doesn't really want to see something else, you can have some devastating consequences. So, but in any event, I think I joked with you when we were putting this together to do a little take on the Woody Allen movie, Everything You Wanted to Know About Sex, and but we're afraid to ask. And here it termed it Everything You Wanted to Know About Travel During COVID, but we're afraid to ask. But it's really not that. What I basically did was just pull a couple of, I think, really relevant things off of the CDC website. And the first thing is you started your sort of description of what you're going to do by your vaccination background. And the important term to know when you talk about vaccination is, are you completely vaccinated? So fully vaccinated, completely vaccinated only occurs after after 2 weeks from the second dose in a Pfizer or Moderna, because they're 2-dose regimens, or after a single dose with Johnson & Johnson's vaccine, which we're not all using right now, not all getting. That's a whole another story. If anybody has questions or comments about that, about the potential wisdom of pausing the use of a vaccine for a very rare event when we're still having shortages of vaccines. But nonetheless, the key point here is 2 weeks. So you have to be fully vaccinated before you even can really sort of consider yourself quote unquote vaccinated. And then if you're traveling domestically, these are recommendations. You can see there's a lot less restrictions in terms of what you need to do, or at least less recommendations if you're vaccinated or not. So if you're not vaccinated, domestic travel, you're getting tested 1 to 3 days before you go, and then 3 to 5 days after with a self-quarantine for 7 days if you get tested, and 10 days if not. And some employers are making that 14 days. They haven't updated their rules or whatever it is. So if you're not vaccinated, there are consequences for when you return, which if that alone isn't, an encouragement to get you vaccinated, that if the safety alone isn't, then this might get you there. But then, everybody's monitoring for symptoms, and everybody's supposed to be wearing a mask and taking other precautions while traveling. The questions about double masking, I think it's not a question at all when you're traveling. I think everybody should be double masked, especially on the airplane, although we'll kind of go through some reasons why the airplane might not really be so worrisome in terms of the air you're breathing in. But wearing a mask and certainly double masking on flights is something that I recommend. I travel still, even though I'm vaccinated too, with an N95 and a second mask on top, which I think is important. When you're looking at international travel, it's a similar thing, getting tested 1 to 3 days before you travel out. It's not mandatory, Dean, that you get tested from the US side of it, right? The airlines aren't requiring, some are, but not all, uniformly airlines are requiring that travelers get tested, but some of the countries that you're going to might. So, you're talking about Nepal, you would know better than I, if they're requiring a COVID test when you enter, but some intermediary points like Amsterdam or other places you might travel through require that as well. But from the US side of it, it's not required if you're fully vaccinated, nor is it required to self-quarantine or anything when you get back. 7 days with a negative test, 10 days without a test, that's not required if you're vaccinated, but everybody needs a test before they come back home. And that's required and mandatory to fly into the US, and it's recommended for all people that you get tested again after 3 to 5 days when you're back. So, you're looking at a test before you leave country to get into the US, and a test 3 to 5 days thereafter. And then, if you're not vaccinated, you're in quarantine at least through 7 days, and then, up to 10 days. And then again, everybody's monitoring for symptoms and looking out for what comes next, right? But, Dean, it's important to look at the ever-changing landscape. And so this is a map of the world, obviously, and it shows all the countries in dark red, or darker red, where COVID levels are quite high. And you can see it's everywhere. And so, we know COVID is running rampant right now, especially in our neck of the woods in the upper Midwest, and soon to be in a state near you. It's going to keep rising and rising. And so a lot of the places that you're talking about are, level 4, very high rates, or level 3 high rates. And so, I think it really speaks to not just the worry about going to that country, but what you can do before you get there to help yourself out. And by far and away, the single most important thing people can do, not again for just the CDC restrictions, is to go ahead and get vaccinated. And you mentioned, Dean, looking at
potentially getting back to not Eastern Europe, but Europe and the Alps for skiing. There's a handful of countries across the world where there's a presidential proclamation limiting entry for immigrants and non-immigrants and non-citizens who are physically present in a country for 14 days prior to entry in the U.S. And so there are other restrictions about even coming back into the United States. And so you see, Switzerland is on there and some of the other countries around the Alps. And so obviously I know you're all over this, checking this to make sure, if you were even to go to a country, can you get back into the United States? But you can see, it's certainly restricted and it's something to consider before you head out. And then, finally, before we kind of finish this up right here, I just wanted to show, I mentioned it before, the large airlines. So the safety of air travel comes from the distancing they're doing on a plane, the disinfection they're doing on the plane, and the masking that you're going to do, again, ideally double masked with one of them being an N95 or a KN95. But the airplanes themselves, especially larger, not regional jets, but larger jets that are traveling transcontinental or longer distances, they maintain clean air. They circulate air through the cabin, and it's recycled using high efficiency particle filters, HEPA filters. And we use these in the hospital, and effectively they filter the air pretty well. Even though the coronavirus is tiny, these get down to pretty low particle sizes that they filter out. And so all in all, if you had your druthers, would you be stuck in a metal tube with 200 other people for 7 hours to go somewhere? Maybe not. But to get to the destinations that you're going to be traveling to and the places where, your clients are going to want to go, our clients are going to want to go, air travel can be considered safe. And again, everything is all the more safe if you're vaccinated.
It makes sense, Phil. I think a couple of the points that you're hitting on there as far as testing goes when we are overseas and we're going to return to the U.S., these are things that we've carefully looked into. Countries overseas are set up to do testing. We do schedule that into our trip itinerary, so there's not really a lapse in us being able to arrange that for our groups, for our guests. So when they are at that appropriate time prior to their departure, it falls into sync with where they are and what they're doing. And they can be tested. When we get overseas, Phil, we're vaccinated. Say, I think a majority of the people traveling with us are pursuing the vaccine, and that's an assumption. But the people I've spoke to, what about our local crews and things? I mean, I have in Nepal, Geljan, my operations manager and good friend. He's vaccinated, so he was lucky to get vaccinated. But maybe not everybody is, and certainly not everybody we come in encounter with. If we are vaccinated, of course, we want to still wear the mask and still do all the precautionary things.
Yeah. So very briefly before we get into that, Dean, because I think that's critically important. You asked me a question before, which I didn't exactly answer, which was about the type of test that's important. Mm-hmm. And the testing that is going to need to happen to get into the United States and to get into a lot of these countries that we're going to look at is going to be what's called a PCR test or a molecular test. And PCR stands for polymerase chain reaction. And basically what it does is it finds the virus RNA or the genetic material of the virus and amplifies it so that if any of that virus RNA is present, it replicates it over and over and over again, and it detects it even at the minutest quantities. That differs from what's called an antigen test. And an antigen test tests for a protein that the virus may make. And, you can imagine that if the virus is still early in the infection stage, it might not have as much of that protein being made, but you'll still be able to detect the genetic material of the virus. Both of these tests can be done rapidly, but the PCR test or the molecular test, both of them will be used interchangeably, is the test that you're going to need to go into any country and come back to the United States. And when you get that test result, you want to make sure that it's not, written on some piece of paper, the corner of an envelope, right? It needs to be a formal thing from the lab. You can often ask for a PDF to be mailed electronically from your test provider, but it needs to be a formal, full-on documentation that talks about not just the test result, but has the lab information and some of the specifications of what they do for their testing regimen. So that's besides the point. Now, getting back to your other question, this is something you and I talked about before we decided to even do this. Is everybody can do everything right, and then you have your trip where you have porters and you have people taking care of the clients who may not be vaccinated themselves. And, I think, Dean, one of the most important things that you impressed upon me was what you do with those folks to ensure that they themselves are practicing precautions and wearing masks and social distancing, not just from each other on the trail or whatever, but from clients as well. Not that you want to keep this separation, because I think one of the wonderful things that occurs on all of the trips that I've been on with you is the interaction between the porters and the local folks and the local guides, right? And the clients. I think everyone loves that. But you got to do, it's tough right now. And so all the things that we want to do on these trips, you can't necessarily do. And so, people need to be mindful of this. Your team is instructed to be mindful of it. And clients need to be mindful too. While you want to have a conversation with somebody, you want to, interact with folks, you have to do it in a way that's safe and limit the amount of time. If you want to talk to someone for a couple of minutes, wearing a mask 6 feet apart, that's great. But, you got to be really cautious, spending too much time around folks that aren't vaccinated, honestly, in today's climate, just with COVID being so rampant everywhere.
Phil, what about with the testing? I do know some people that had contracted the coronavirus. They were less symptomatic as far as their during the phase of having coronavirus, but they too, they need to potentially get vaccinated. I know that it's 3 months delay after you've been diagnosed with the coronavirus before you can get the vaccine?
It's actually changing a little bit, Dean. It's funny. I just did a story, 2 days ago for a local paper on this very topic. Not only is it changing, it's also uncertain if you get coronavirus after your first dose, which is starting to come up. And so the question is, why delay? And so let's start with that and then kind of walk back from there. And then we can get into the testing if you've had coronavirus, because I think these are really important questions. So first and foremost, the thought right now is that when you get infected with coronavirus, you have antibodies which will protect you from subsequent infection in your system for about 3 months. And that doesn't mean that you aren't protected, because it's not just the antibodies. There's a whole other immune component that protects you, something called T-cell mediated immunity. Nobody on here listening ever needs to know that again, but just understand that your body is prepared to fight off another exposure to coronavirus, even if you don't have antibodies present. But nonetheless, the antibodies are there for 3 months. And the thought initially is that if you get the vaccine during that 3-month period, you're not going to boost your immune system anymore. So you might as well not get it and let the dose go to someone else who hasn't been recently infected with coronavirus. As the supply chain is opening up a little bit, we're starting to think differently about this. And people are really saying, and the CDC guidance on this is that people should get vaccinated after they have coronavirus, when they are no longer symptomatic and feel better. And so this was the debate that I had with this discussion I had the other day that holds true for first dose or second dose. So if you get the first dose and a couple of days later you get, test positive for coronavirus, the question is, when should you get your second dose? Or again, what should you do for your first dose? And so if you're not symptomatic, meaning you're feeling well, you have no problems, after that about 10-day period, it's okay to go ahead and get your coronavirus vaccine, even though you just had coronavirus. Same thing with your second dose, right? Because now the supply is more open and it's not as restricted in terms of who can get it. So that 3-month window period is sort of probably not where, not in the recommendations right now, basically, because of the local availability. And it's, that could also be state by state. But then the other piece of this is that the testing side of it, right? So the vaccine side, we just addressed, but the testing side is a little more complicated, because you could stay persistent positive with your coronavirus test for 2 to 3 months after the virus infected you. The reason being is that so the virus infects you
the infection peaks for the vast majority of people 5 to 7 days afterwards, then it wanes. During that 7 to 10 day period, you're no longer considered infectious, which is why after 10 days you can be out of isolation and back to business. The thing that actually happens though is that during that 3-month phase, the virus is dead in your body. I could come swab you, Dean, and still detect virus, but you're not actively shedding infectious virus. So in the beginning, when we were doing this test, we would test people over and over and over again and wait for a negative test. We don't do that anymore. In fact, the CDC says don't get a test for the first 3 months after your coronavirus infection. So the CDC allows people to not have a test result if they can show a positive coronavirus test within the 3 months before their travel.
Okay. I do have a question here that's kind of related to the trip I'm taking. Someone's asking, what special precautions are the tea houses in Nepal taking? And I'll know more when I get there, obviously. I would say that on our trips, one of the things that even prior to this whole, if we rewind it back 2 years, for us, hygiene is critical to keep people healthy, whether it's on Kilimanjaro in a tented camp or in a tea house, all over when we're in remote areas. So, hand washing stations for sure, and we'll probably up the availability of that a little bit. I would assume that they're wearing masks in the tea houses. And as well, for us, it's a little easier to socially distance on the trail and in the outdoors, which is where we spend the majority of our time. But sending our runners ahead to make sure that we've got our spot set up and we're distanced from other groups the best we can and things like that will be something that's really important. So it's up to us as outfitters to provide the healthiest environment we can for our groups. I do think that as we begin to travel and travel starts to take place, one of the things we might enjoy out of all this, to try to take the positive out of a negative situation, is probably some really quiet areas around the world as we get going, So I can imagine that there's a really quiet Kilimanjaro going on right now, and as well the Trek to Everest Base Camp. I'll know a little bit more of those as I go and as we go on our trips around the world. Our local outfitters and operators are awesome. Geljan in Nepal and I have been speaking regularly to get ready for me to come over there. And then it's up to us to, as an outfitter, to provide the environment that our guests are going to enjoy the most. And that's usually distancing ourselves from other groups the best we can all the time, just because it provides a better experience for our guest. Phil, so during the trip, I think that's a big part of it, is not letting our guard down because we're vaccinated, being respectful to the other people that are around us and might not have the opportunity to be vaccinated. I guess it's, social distance, wash your hands and space out and that and all of that as a rule that we've all been accustomed to these this last year. Anything else that you want to interject about the trips that we're going on or the place that we're traveling? Of course, we're going to check in very much so with all the areas, and we have operators there that are our operations managers to be our eyes until we actually arrive.
So, I think the trips certainly are amazing, and it's an important thing that people who go on these trips try to balance the cultural exposure to the natural beauty exposure, right? And one of the things that is great in Kilimanjaro is going to the Arusha market. One of the things that's great, in Kathmandu is walking through the crowded streets at night when there's no light and the fires are going and the whole place feels like it's filled with smoke and there's like 1 million people. But unfortunately, those experiences aren't going to be there this time. And I think people have to come into the trip accepting what the trip is now and going to the trip with that in mind. You have to be precautious, and even though you want to seek out the experiences that we'd all want to seek out from a trip like this or trips that you're doing,
just be smart, right? And if if it feels like the market is well spaced out and there's enough room between people and you feel comfortable walking through, that's one thing. But if you're going to be in a really congested and confined space with a lot of folks who you have a lot of uncertainty around their COVID status, and we probably know the vaccination status is pretty low, right, in a lot of these countries. So just be mindful. I think that's the right answer. And be mindful, because this trip isn't just about yourself, right? It's about a whole group of other people that you're with on the trip. And everybody has to do their part to make the collective successful in the endeavor. And I think you guys do an amazing job, Dean, of making sure people are safe. And I think that not deviating, having people stay within the lane of what you guys are setting up to keep people safe is smart. The trip is going to be amazing, without that 1-2 hour market experience, where you buy some trinket that you put on the shelf and maybe never look at again. You know what I mean? So I think it's tough to say, and that's not to disappoint anybody. It's really just to say, of course you can travel, but you can travel better if you're smart.
I think one of the things that you kind of hit on is the experience with our local crews. And one of the things that our guests, if you've been on our trips before, know that we do a medical check on our crew, our guests every day, especially, at the high altitude trips. We check to see if they've taken their Diamox, we take their temperature. We're adding the temperature this year, actually, the pulse ox reading, just to check the basic body, how they're feeling in general, if they're going to the bathroom, eating and sleeping normally. These are something that we are adding to our entire teams, say on Kilimanjaro as well. We'll be monitoring our guys prior to going on the trip to make sure they're starting from a healthy standpoint, and then monitoring them as we go on the trek itself, whether it's on Kilimanjaro or in Peru, as these are the ones that are coming up.
So Dean, effectively by doing that, you're creating your own bubble on the trip, right? And everybody comes into the trip clean, right? Because they've been cleared, they don't have COVID, they're not going to introduce it necessarily into the environment, right? And so the goal for the collective has to be to maintain that bubble. Right? Anything that could potentially introduce from the outside can threaten the safety of everybody. And so that's where I think, you doing what you're doing, checking to see if there's anything that signals someone may be sick, and pulling them away from the circumstance as quick as possible is important. And then just people, again, being mindful about not introducing something outside that doesn't need to be there or shouldn't be there.
I have a question, from my standpoint, one I've struggled with a little bit, and that is just when people sign up for a trip, we often are asking them their health related questions, their height and weight, a lot of personal questions. Are they allergic to anything, food and that? Do you feel that it's, okay to ask about people if they've been vaccinated or not? I know for somebody who doesn't want to, it might be a touchy subject.
Yes, I think it's okay. And in fact, I think it's smart, right? Particularly for the leadership of the trip to know who's vaccinated or not. And then, I think it's fair to ask if people would like to keep that information private, right? It's a tough situation these days because, you want to protect people's rights to information, but people are trusting everyone else, when they go on a trip like this. And they're coming into it saying, I trust that everyone on this trip is going to do their part to keep us all safe. And so part of that is the vaccination information. But what you really want to avoid, and one of the things that I'm kind of against, mandatory vaccines, even though I think everyone should be vaccinated, people still have personal choice, right? And what you don't want to do is set up any dynamics where someone feels uncomfortable because of their belief system that has led them to not be vaccinated. And you certainly don't want to spend 10 days on a trip, hearing people argue about you should be vaccinated and you shouldn't, that type of stuff would just create disharmony, in the trip. But I think with your clients, the members of the trip, sharing information with you as the leadership, I think is important because I think it helps you understand what you have to manage on this trip. If you have a trip that entirely has all unvaccinated people, that's a much bigger challenge on your end.
Yeah, I mean, I'm quite familiar with HIPAA laws, working at the ski resort for a number of years. I have had a number of people, when they see an accident site on the mountain, say, what happened to that guy and this and that. You know, we can't talk about personal things. If somebody flies out from, has a rescue halfway to Everest Base Camp, when they get back to the Kathmandu and get checked out and they're fine one way or the other, we don't give the general information to the group. If their spouse or partner chooses to share information, we don't share that information. I am, however, getting people asking me, are people going to be required for us to have the vaccine? And I agree that that's a personal choice, and they have to travel in and out of the US under the guidelines that they set forth, as well as the destination that they're traveling to. So I've got another question here. Heading to Tanzania mid-July for a trek on Kilimanjaro. Any insight on how to interact with the crew, porters, vaccinated travel here? I think we just answered that for the most part, but we're just wanting to be, and you can chime in, Phil, but respectful of our crew, knowing our crew is going to arrive for our trip healthy. We're going to medically check them every single day and prior to our starting on the trip. And then, on Kilimanjaro, for example, since that's the question, the porters, the tent crew, the toilet attendants, the guys that do the behind the scenes supply stuff, there's not a whole lot of really close interactions with our guests. The front line guys, the waiters in the dining tent, maybe some of the cooks, but they're usually in a separate tent. The guides, of course, just being a little bit more distant and being a little bit more vigilant on masking up. And of course, my teams will be masked up all along the way, and we're providing those.
So Dean, to that end, I think it's important for people to hear, culturally speaking, right? It's acceptable to leave your mask on. It's not insulting. It's not a sign that, you don't feel comfortable with somebody. I know there's a lot of, I remember, again, trips that I've gone on, there's a lot of great personal interactions that occur with the guides. These guys really care about the people you're taking on the trek immensely. And at some levels, right, they're really pulling somebody to get them to the top of that mountain and make sure they get back down safely, more importantly. But if you're talking with them, do they feel uncomfortable with people still wearing masks and anything like that?
No, not at all. I mean, they understand that it's the way of the world. The one thing about this is it's not like it's affecting. In the past, we've had situations where there's some political uprising or something at a certain destination. Nobody outside of that area knows about it except the people that are going to travel there or the people that live there. This has affected the entire globe, so it's not like it's unknown. And we, as a business, have the obligation to train our teams on what our standards are. And it doesn't matter if they work for other agencies, it's how Worldwide Trekking does it, right? Yep. So we train on our high standards, and that's very important. And as well, as our teams all around the world are some of my best friends, and right. I care about them greatly, and we want to make sure that they're safe, their families are safe when they return to them, and everything else.
Yeah, so it was a little bit of a loaded question. I was hoping you would answer the way you did, because I want people who are going on the trip to feel comfortable keeping their masks on. Your porters are going to keep their masks on. The guides are going to keep their masks on, and it's not insulting to you as a client if the person leaves their mask on too. We all want to feel that bond, and we know what it feels like to get with friends. You take your mask off. It's like you stepped into a more comfortable zone. I would just say that comfortable zone should not be one that we're striving for on these trips. It should really be just keep doing what you've been doing for the last year, wearing a mask and staying distanced.
Okay, I want to remind people we're starting to head towards wrapping it up here. So if you've got questions, please chime in. Just type them into your keyboard under the Q&A or the chat, and I'm looking at both of those. Phil, when we return back to the US, like I said, we're going to provide the opportunity for people to be tested when, as our trip's kind of nearing the end. And we've researched this extensively. Say we'll use Kilimanjaro or Tanzania as a trip that's coming up, that whether you come off the mountain on our route, we go right past the KCMP Medical Center. Test is available right there. They, do their test. They're going on safari. They can test in Karatu. They can test out in the Serengeti. And it's all a timing thing to make sure that they're tested and have their results back right as they leave to travel back to the US. When they travel back into the US, I think having that document, like you said, complete, not just I got a positive result here, but the type of test and all the details in it. And then when they get home, Phil, anything upon returning that that people should be thinking about, or when they do come back?
Well, one good thing that the U.S. government did is they didn't say 72 hours; they said 3 days. So you don't have to worry about is it 3 days or is it 3.5 days now, because my flight's at midnight and I got tested at 8 a.m. 3 days ago. They've left it at 3 days. So I know this, but so everyone can rest assured that it doesn't need to be 72 hours. It's, if you need to leave on a Friday, you get tested on a Tuesday. It doesn't matter when on Tuesday or when on Friday. So that's important, number one. I think the other piece is just what you're going to do when you get back. And if you're vaccinated, you're not quarantining. If you're not vaccinated, you're quarantining. And I think that's just something that people should anticipate. A lot of people plan their trip and their vacation and then get back right to work as soon as they get home. And, if you've transitioned to in-person work, you're going to be at home for a little bit. And so anticipating how you'll handle that is an important part of your, pre-travel planning.
So I think that what we're kind of thinking, I know I'm vaccinated, I know that you are as well. That's kind of what we encourage people as things move forward to do, but it is a personal choice. As we wrap it up here, if you have questions, tune in. If not, Phil, do you have, there's different vaccines available. I got the Moderna vaccine. Do people need to worry about what one they're getting, in your opinion, or?
No, and the data, so everyone is clear on efficacy, Johnson & Johnson may not be as good as Moderna or Pfizer. There's a lot of nuances that go into those numbers, but the most important thing is that you will be protected against hospitalization or death or anything significant like that. There's not a preference. The most important thing is the vaccine you can get is the vaccine you should get. And, there's a little bit, the one thing is that if you're not vaccinated, and this encourages you to get vaccinated, or you haven't been vaccinated and it's getting close to your trip, the Johnson & Johnson does offer it's a 2-week window effectively, because you get the dose and then 2 weeks later, you're good to go. With Pfizer, it's a 5-week window, because you get the first dose, 3 weeks later, you get the second dose, then you have 2 weeks to wait. With Moderna, it's 6 weeks. First dose, 4 weeks later, 2 weeks after that. So the quickest pathway to get to fully vaccinated is going to be Johnson & Johnson. So, if your mind changes, hopefully, Johnson & Johnson is going to get back on track and be able to be used. I wouldn't fear the complications people are talking about, honestly. This is 6 cases of venous thromboembolic complications out of 7 million vaccines administered. We're seeing similar things between AstraZeneca and Johnson & Johnson. One of the things that is going around, Dean, that's probably wise, and it doesn't hurt anybody anyway, if you get Johnson & Johnson, the low-dose baby aspirin for a month, 81 milligram baby aspirin. Some people are starting to recommend that, and I believe that that's a very innocuous thing that could provide some protection.
Phil, we've got another question here about mask wearing. And it's saying, what are your thoughts on wearing a mask for personal protection, like at the grocery store, as opposed to wearing a mask to protect others?
So that's a tough one, right? The N95 mask, KN95 as well, will provide protection for you as an individual more so than cloth masks or surgical masks, but they are all better than not wearing a mask. And so that to me, I wear a mask because I want to be part of the solution. You know what I'm saying? I want to be somebody who's wearing a mask in public and seeing others doing the same. I'm vaccinated, so I'm not worried really about my exposure unless I'm in the ER and, you know, and people are coughing everywhere. But that said, I think that if your primary motivation is to protect yourself, then an N95 mask is going to be the best one. KN95, because they're a little bit easier to breathe with. But either way, just like I said, any mask, a surgical mask, more so than a cloth mask, will still provide some protection for you.
Okay. So I think we'll wrap it up. Phil, do you have anything else to add before I kind of sign off here? Or?
You know, Dean, I think it's important for people to know that I've traveled plenty during this. Not because I've been reckless or not because I haven't wanted to, you know, adhere to guidance or anything like that. You're allowed to travel freely. It's just how you travel and being conscientious and precautious. And, you know, it's not the time to walk up on the person in front of you on the escalator. It's not the time to, you know, try to huddle together with people to, you know, be first in the taxi line. Space it out, take a little bit more time, relax a little bit. And particularly on your trip, you're there to have a good time. You're there to enjoy yourself. Maximize your chance of doing that by doing all the things we talked about.
And Phil, as we've talked about, you know, the landscape's rapidly changing. And I think what we are doing is, you know, watching the CDC website and things like that. Of course, I consult with you. Do you think those are the appropriate things to do? I mean, we watch out for our guests, and I think that's probably where they're going to get the best info.
Yeah, I think your guests can rest assured that you and I talk on a regular basis about things. As the landscape starts to shift and change, we're going back and forth discussing what that means. But everybody should be comfortable, you know, consulting with the CDC website, www.cdc.gov, and coronavirus will be one of the first things that pops up there. And they have pages upon pages of accessible information. It's not written in medical speak. It's not there to confuse you. It's very transparent and very easy to understand.
Okay, well, Phil, I want to thank you for taking the time with us today. We are looking forward to get back to travel. I really, again, appreciate all of your assistance. Personally, questions I have about trips and guests, and then of course, you know, above and beyond going out of your way to respond to somebody's email or put them in contact where they can chat with you directly. That's been really, really comforting for the people that have had questions that I quite frankly don't want to answer or just want to pass off to a higher resource, you know?
Yeah. So it's labor of love, Dean. I love doing this for you and for the clients. And so if anything else comes up, they can email you and, you know, they'll get to me, and within 24 hours, pretty much guaranteed you'll have your response.
Yep. And that's been great over the years. And we are looking forward to get back to travel as always on worldwide trekking trips. You know, we go to high altitudes, we go to push people to their limits a lot of the times. We set up environments for people in kind of rough conditions and extreme places a lot of the times. And we try to do that with every mind of our guests' comfort and safety first, and the safety of our teams around the world. And, you know, coming together, any of our trips are accomplished by our local resources and teams coming together with our guests and the leadership all coming together and being one big team. So, you know, we won't lose sight of that in any way as we venture back into travel. It's been a long year without travel. I think a lot of people are anxious to travel as we are. I know I am, having spent 7 months a year out of the country in the years past, and then being home, I'm very ready to get on a plane and go explore the world as I always have. So if you have any future questions, things that come up, feel free to email the office, contact me directly. Phil, thanks again so much for taking the time. I really appreciate your friendship, and I really appreciate your guidance as we navigate this landscape and of course, all of the things we've been through in the past.
My pleasure, Dean. I'm here for you anytime you need me.
Thank you, Phil. Have a great day. Have a great weekend. And thanks everybody for joining us.
Take care, guys.
We are going to do some live, some broadcasts from Nepal in the next week or two. And that might mean I got to get up early and do those at the appropriate time, but that's the plan. And we'll see how I follow it. Thanks for tuning in. Thanks, Phil.
See you, Dean. Bye, everybody.